China has stepped up its campaign to help Africa move up from the vaccine queue, where it otherwise may not get COVID-19 shots quickly. Rich countries have almost gobbled up available COVID-19 shots around the world, leaving Africa groping. China says something can be done about that. Correspondent Enoch Sikolia reports from Nairobi.
The scramble for COVID-19 vaccines is taking shape even as countries globally enter a new phase in the pandemic response, that of vaccination. The race to inoculate millions of citizens with the life-saving jabs is on around the world. But Africa is lacking behind. Hopes of vaccines early enough have dimmed, with rich economies having already purchased millions of vials from Western producers. African countries have been pushed to the tail of the queue. But African countries such as Kenya have already smelt the coffee and are increasingly looking elsewhere to guarantee supply of COVID-19 vaccines.
Even as we talk about the Oxford, the AstraZeneca vaccine, we are also negotiating with the others as well, including the Sinopharm in China. We are looking at the Pfizer's. We are looking at all the other vaccines that have been approved.
Kenya was waiting for a vaccine to be delivered through the COVAX facility, a WHO-led project working largely with Western manufacturers. But as reported by Kenya's Star newspaper, President Uhuru Kenyatta ordered the Ministry of Health to extend the search far east. The decision also welcomes the testing of a Chinese COVID-19 vaccine in Kenya. In Africa, only Morocco and Egypt are testing a Chinese vaccine candidate. The decision was made because the toll of coronavirus in Kenya is worsening.
We will not be relying only on one type of vaccine. The ideal thing to do is to use several so that you can increase also the chances of a higher efficacy.
Kenya believes that the timely supply of affordable and effective vials will not only cushion lives from the disease, but more significantly ameliorate the biting economic impact of COVID-19.
I'm cognizant of the fact that health interventions are critical to our fight against COVID-19.
Kenya is targeting to vaccinate at least 30% of the population at a cost of $110 million and has singled out priority groups.
We start with the healthcare workers because those are the first line. As soon as the first line workers, and the first line include even people like the police, the healthcare workers, the teachers who are in schools, students and so on. So we have got a system which we have issued.
China appears to be the ultimate go-to place for Africa and developing countries in Asia and Latin America. Now, there are a number of reasons that makes Beijing a partner of choice in the global COVID-19 vaccine economics.
The Chinese vaccine presents itself as being relatively affordable compared to Western alternatives. This makes sense for Africa at a time of unprecedented financial pressure. China has demonstrated its commitment to stand with Africa in the fight against the virus since the outbreak. Chinese experts were seconded to the continent to provide on-ground support to over 40 countries. This was followed by massive donations of essential commodities ranging from face masks, ventilators, testing kits, protective clothing, and medicines. Chinese leader Xi Jinping has from time to time reiterated the need for targeted international support that can enable developing economies to overcome the pandemic afflictions.